I'm very pleased to introduce my colleague, Dr. Erinne Kennedy. She graduated from Nova Southeastern College with her dental medicine with a doctorate of dental medicine degree. And she completed a 1-year GPR at the VA hospital in Baltimore and a dental public health residency in 2018. So she also has her MPH degree. And then she completed a master's of medical science and dental education at Harvard School of Dental Medicine in 2019. Dr. Kennedy is the director of predoctoral education at the KCU College of Dental Medicine, and she has served as an expert on the American Dental Association's expert panel for developing guidelines for antibiotic stewardship for oral health clinicians in clinical practice, which she has also been working with colleagues to disseminate. She's a contributing editor for Dental Economics and on the junior editorial board for Dental Entrepreneur Women. She's been named as ADA's 10 under 10 and Binco Dental's 40 under 40. And in today's seminar, she's going to discuss what your saliva says about you. And the title of her presentation is Liquid Gold, What Does Your Saliva Say About You? Dr. Kennedy.
Thank you so much, Dr. Gordon. I'm thrilled to be here with you all today. And for this Science Friday, we're going to talk about articles and how literature can inform how we practice dentistry and, in fact, how you take care of yourself. And we're going to learn about what we can learn from your saliva and how we can make your saliva even closer to liquid gold. So saliva is the fluid of dentistry, and we are just starting to tap into this science. And so we're going to dive in and actually go through a timeline today because we've been looking into saliva for a long time, but taking action and really understanding and apply it to practice has taken a little bit longer. And so today's key learning objectives. First, we are going to just breeze over some of the elements in your saliva, both in health and in disease. I picked out one marker to focus on, but we could spend the next 10 hours going through a bunch of different markers in different disease states. So I'm picking one that's actually really fun to talk about. And then we're going to dissect the meaning and importance specifically of ammonia and how you can learn about when you understand your level of ammonia, you can actually understand a little bit more about your healthy oral microbiome. And then I've brought in a couple cases of patients that I've seen in my own practice. And we're going to talk about different strategies we've used to help make them a little bit healthier. And so before I ever start anything, I love to have a pause session. Pausing is actually one of the ways that we can learn faster and learn deeper. And so Gail is one of my friends, and she wrote this amazing book. She spent years teaching younger students in middle school and high school, and eventually moved into medical education because she was just stellar. And her book basically gives you 65 ways to pause. And today we're going to do a KWL chart. So you can grab your phone, you can jot something down on a notepad if you like the OG notepad with just a pen and paper. But you want to think of something, what do you know about saliva? And you might say, I have it. Okay, it's okay. It can be very simple. Just really quick, what do you know about saliva? What do you want to know about saliva? And then you're going to leave L blank because we're going to do that at the end. And we're going to talk about what you've learned, at least one thing that you've learned today about saliva. So I'm going to give you just about 30 seconds to do that. And then we'll go on. Okay. So we're going to dive right into, before we talk about what you know and what you've learned, we're going to pull that all together here in just a second, but we're going to talk about the functions of saliva. So when you think of a bodily fluid, your blood is a carrier for a bunch of different molecules throughout your body. It provides oxygen. Without blood pumping through your system, you wouldn't have living tissue. And so in the same way, saliva has functions all throughout your oral cavity. and even into the start of your digestive system. And so it's an ion reservoir, and now they make restorative materials that actually can use those ions to help make your teeth harder and stronger. It's a buffer. It cleanses your mouth. I don't know if you've ever had a really dry mouth and tried to eat a peanut butter sandwich, but it usually sticks to the roof of your mouth because there's not enough saliva trying to wash it down. It has an antimicrobial action. It agglutinates. It forms a pellicle on your teeth, which allows a healthy microbiome to form. It participates in digestion. You have alpha amylase. It helps with taste. If you actually don't have saliva, you can't taste. So if someone changes their medication and their mouth becomes more dry, one of the first things they'll say is, my favorite food doesn't taste the same, or my favorite drink, or something that I love to eat. Taste, it helps with taste. It helps with, it's just an excretory mechanism of your body, and it helps with water balance, and it's a lubricant. And so all of these functions are really important for saliva. But in addition to that, we know that it helps with different functions of your body, but it's important to understand that it's not only the quantity of saliva that helps facilitate these functions, it's the quality of saliva. So on average, you produce about 1 liter of saliva each and every day if you're a healthy human. And if you take a look and think how much saliva would that be by the end of the year, it would be about 95 gallons, which would fill just about this large bathtub. And your body produces that each and every year to help fulfill all of the functions that we just talked about. And so when you think about this, you think about an interaction between quality and quantity. It's actually not 4 distinct buckets like this. It would be if we all put our saliva biomarkers and our quality and our quantity in some sort of measurement system on this chart, it would be a scatter plot. We would be all over the board because each and every one of us would have a different level of quality based on how much water you had, what medications you take, what time of day it is. And so our goal in dentistry is to help patients achieve the highest quantity and the highest quality of saliva every day that helps them live out the functions that we just talked about. And so I call this liquid gold. And the reason I call it liquid gold is because if you've ever had a patient who has a drier mouth, you know that when their functions are inhibited, it's actually really challenging. And they will say, I would give anything for saliva, almost as if it was liquid gold. But your saliva has more than just, it has a lot of components in it, right? So it has gingival secretions, which is fluid that comes from your gum tissue. There's nasal secretions, there's epithelial cells, there's serum and blood derivatives. You even have bacteria, fungi, viruses, food debris, other cellular components. So inside this liquid gold, you might be wondering, what does it all contain? Well, most saliva has multiple organic and inorganic components, just like you see here. And we don't measure all of these chairside in a dental office. In fact, even if you go and you have a sample sent away, we are working to identify different markers that can be measured so that we can better understand your level of health. And that area of research is expanding all the time. And so today we're going to pull out one of these components so that we can understand a little bit more of the impact ammonia has on your oral health. And so what's really important to understand about saliva, and I explain this to my patients all the time, is it's ebbing and flowing, not only throughout your day, throughout your week, throughout your year. There's normal human variability. So each and every one of us, like I said before, are different. And it's stimulated and sometimes it's unstimulated. So I haven't had a meal in over 2 hours and I haven't chewed any gum. I haven't done anything. Right now I have unstimulated saliva, except I'm starting to talk. So it's starting to become more stimulated, right? But if I had a really delicious meal that I was smelling and it was sitting right in front of me, all of us have cues when we start to smell food like that, we start to salivate. And so the composition of unstimulated saliva, what I have right now, is very different than if I had a meal sitting in front of me. Aging impacts saliva. Medications have a massive impact on saliva. In fact, we could spend 4 hours talking about just the medications. Also diseases like cystic fibrosis and Sjögren's syndrome all impact your salivary composition, and even circadian rhythm. So your saliva is very different in the middle of the night than it is in the middle of the day or right when you wake up. And that's because everything is influenced by your hormones as well. And so what's really important to know about saliva is that how does this translate to chairside care? So how can I take what we know biomedically about saliva, and how does that influence how I treat my patients? Well, I like to think about like the 101 of chairside screening. So there are two ways to measure your saliva. Something I can do if you're sitting in my dental chair, and then a test that I could send away to a lab. And so the same is true if you're thinking about blood markers, right? You could prick my finger right now and test the amount of sugar, the amount of glucose in my blood. That's a chairside screening. You could equally draw a vial of blood and send it to a lab and have my blood glucose taken and a number of tests. And so these tools are a combination of what you can offer chairside, and then sometimes these companies also have you send a sample to their practice or their office. And so we can measure many different components chairside. And I put this on here because I think it helps understand the grasp and why we're choosing saliva as a medium to study. One is pathogens. Two is genetic changes that can represent or show that you're at a risk or have periodontal disease. There are protein tests for testing for oral cancer along with mRNA. And also we really spend time understanding certain factors that could put you at risk for tooth decay or having cavities. So how much saliva you have, the quantity and the quality of saliva that you have, certain bacteria that might be within your saliva, how well your saliva buffers. If I wanted to go out into my kitchen and grab a donut right now and measure using a test after I ate that donut, how quickly my body was able to come back to homeostasis and a neutral pH. And also pH, just the same way as you can test urine or even blood for the level of pH. In those two mediums, we look at saliva in the same way. And so that is a little bit of background and context for studying one marker within your saliva. I think it's helpful to understand a little bit more about the background, because that isn't something that we all talk about all the time. So what does your saliva look like? We all go to an annual physical each and every year and kind of understand, maybe what our cholesterol is or what our last CBC was, right? But very few of us look at our own saliva or are involved in a practice that studies our own saliva regularly to say, you know what, I know that I've been able to increase my buffer capacity this year, or I've been able to increase the quality or the quantity of saliva that I have. And you know what, it's actually made speaking easier. And you know what, I'm more comfortable during the day and I don't feel like I need to drink as much water. And so that kind of sets you up to say, saliva is incredibly important. It's very complex. There's a lot of different factors. We barely scratched the surface of what we're going to be able to learn about you from your saliva, but many researchers are working on it. And more importantly, it kind of says we are currently working on many different ways to not only test and look at your saliva in an instant, but also be able to gather more information by sending it away to a lab. And so today I want to dive in and look at one component of saliva, which is ammonia. And ammonia is kind of tricky. And I say ammonia is tricky is because there's different articles that can show different components. So I'm going to explain that to you today, but it's just really exciting to study something like this because it really helps you understand a little bit more about you. So when you think of ammonia, what do you think of? You can just go ahead and call it out. You don't need to raise your hand or anything.
Window cleaner.
Thank you so much, because I didn't pay Dean Neeson to say that, but she was spot on. When I think of ammonia, I think of My Big Fat Greek Wedding, the movie. And then I also, right after I think of that, I think of Windex. And it's totally true. So we've been studying ammonia in saliva because it actually helps us understand how clean your mouth is and the level of health in your oral microbiome. And so this is just an example of what I've used chairside in my own practice, but I've taken a saliva sample. There's different pads that have different chemical reactions that can actually show you and measure different components. And this is the reaction that actually measures the level of ammonia that you have based on a color change. And that gives you a quantitative reading. And so for my patients, I can actually take a sample of their saliva and understand the level of ammonia that they have. And the reason that that's important is because I can actually understand the level of ammonia that their good bacteria are giving off inside their mouth. And so if they have low readings, that means that they usually have a good commensal bacteria that are helping keep their mouth incredibly clean. If they have really, that also means they likely have good oral hygiene. So it's a way to show objectively how well and kind of like a benchmark for how awesome they're doing at home. So if you think about this, if your dentist has ever asked you, hey, try this new toothpaste or check out this new toothbrush, or you know, you come back and I want objective data. I want to show that I reached 10,000 steps. I want to know that everything, all the hard work that I'm putting in every day is paying off. And actually some of these numbers can really be helpful for that. And then if you have really high readings, oftentimes you have a lot of bacteria in your mouth. You have a very, what we call heavy biofilm, often clinically, and these are patients that can benefit from just different resources in improving their oral hygiene at home. And so we've been studying, researchers have been studying for ammonia for a really long time. And they first started studying ammonia because they were really trying to understand a term called halitosis, which is bad breath. And they found that when patients had really heavy biofilms, they often had halitosis or bad breath, and they wanted to see what would change that. And so they first started looking at this in the 1940s. And there was a series of papers that were looking at ammonia salts for the control of dental caries. And over time, they said, okay, after the dental caries piece, they started to say, can we understand halitosis? And so they looked at using ammonia to measure halitosis as a proxy for poor oral hygiene. And they used 3 different ways to measure ammonia in this paper, but they found that after brushing and scraping the tongue, the ammonia levels decreased. And they found this could maybe serve as a proxy for understanding how clean a patient's mouth is, which is really helpful in research, right? Because it was an objective measure. It was something that would be easy to study. And so they kept trying to understand a little bit more. And in 2006, this article then kind of shifted and said there were certain bacteria that were actually producing this malodor. And they were understanding that many of these bacteria were actually growing on the tongue. So, and on the teeth. And so they actually found that some of these bacteria were actually associated with fresher breath. And it's interesting because since this study, they've actually used some of the strains of those bacteria to make probiotics to help people freshen their breath. So it led to a whole nother series of articles. And then this is when it was really interesting. And about 6 years later in 2012, this is where they started to understand how it interacted with the oral microbiome. And they shifted away from understanding whether or not someone had bad breath to, okay, how can we use ammonia to measure how healthy their oral microbiome is? And that is where we are today. And they've shifted from asking the question when it comes to the bacteria in your mouth, who are they, to what are they doing, what are they producing, and how does this link, I'm adding on to these researchers, but how does this link to whether or not a patient is healthy or not, or how we can help them become healthy? And so it was just really interesting how they've shifted and how there's been a timeline of research over the years. And this was one of the most interesting papers, and it was published in 2019, and they actually looked at 79 children, and they looked at how likely was their biofilm to contribute to causing a new cavity. And they looked at children that were caries-free, children that had caries or dental cavities that were just into the hard tooth structure or their enamel, and then caries or cavities, or children that had caries and cavities that were a little bit deeper. And they tried to understand if the activity of their biofilm was different. And I'm going to explain to you exactly what they were looking for, because there was a term that they were measuring, and they called it the arginolinic potential of plaque. And you might be wondering, how does arginine and ammonia connect? And why are you talking about these two totally different things together? Well, they're actually interrelated. And so this is one of the papers that's actually going to show us how they took this information and put it into practice. So the previous researcher found that children that did not have a single cavity or any tooth decay in their mouth, their microbiome was able to metabolize arginine really well. And when we metabolize arginine, one of the byproducts, can you guess one of the byproducts?
Ammonia.
It's ammonia. It's Windex for your mouth. And so what was really amazing is they said, this is really important. If we can help microbiomes have the capacity to break down arginine or even use arginine as a vector, this produces ammonia and it raises the pH of your mouth. And it basically creates a cycle that helps your microbiome become healthier and healthier. And so the next series of researchers said, what can we do with arginine to deliver it to a patient's oral cavity? And this article was the article that took her previous work into practice. And so they actually added 1.5% arginine to toothpaste. And they actually found that the patients that used this arginine toothpaste had increased ADS activity, or they were able to break down arginine. And this changed the pH of their mouth and of their plaque, and it made it more neutral. And they actually found it helped prevent the incidence of tooth decay or cavities. And so this is so powerful because we all have an oral microbiome. And our goal is to boost up the commensal bacteria as much as we can and decrease the amount of pathogenic or negative bacteria that we can. And the same is true for all of our microbiomes throughout our body, whether it's on our skin or in our gut or any other orifice of our body. Bacteria actually help us be who we are. And so when you're taking a look and understanding our microbiomes, I almost like to think of it like a fingerprint. You know, each of us all have a different thumbprint. It's completely unique to our body, right? The same is true for our oral microbiome, but it is influenced by who we're around. And it's also influenced by what we eat, what we put in our mouth, and the health of our entire body. So it is one of the ways that we understand the oral systemic connection. And so each and every one of us at any one point in time, which we've talked about all the ways your saliva and your oral microbiome fluctuate throughout the day, throughout the year. One of the ways I explain it to my patients is think about a pond. Think about if you were someone studying a pond. If you took a water sample in the morning, in the evening of that pond, in the deepest parts and the shallowest parts, in May and in July, in the hottest day of the year, and again in December, all of your water samples are going to be totally different. There's going to be different bacteria. There's going to be different levels. It's going to be different concentrations, right? Sometimes there's going to be more water. Sometimes there's going to be more other components, right? The same is true of your saliva. So each and every one of us have about 100 different bacteria at any given time. But what's amazing is that you can shape the 100 bacteria that you have pretty quickly. And what's wonderful about that is you can shape it and it's adaptable and you can actually create health in that way. If it was fixed, it would be really hard to help patients become healthier once they have a bunch of pathogenic bacteria. But that's not the case. The commensal bacteria actually regenerate much more quickly than any of the pathogenic bacteria. And so you can shift your microbiome much faster just by feeding good bacteria exactly what they need, which what we've been talking about is arginine. And so does anyone remember the Krebs cycle? If you are afraid of the Krebs cycle, if it gives you stress because if you remember exactly how that made you feel when you're in college, just beware because the next few images will remind you of the Krebs cycle. But it actually shows you how ammonia is produced in the oral cavity and why that's important. So it's actually, there's two mechanisms in your body that produce free ammonia. And both are the product of a healthy oral microbiome. So first, there's urea, and I don't know if you can see the urea on the slide. I think you can, I hope you can see it, but it's in the upper, kind of like center to the left. But urea is actually in all of your salivary secretions. So it was in those 2 teardrops that I showed you earlier. And it's about the same as what's in your blood serum. So you have urea there too. Urea is rapidly hydrolyzed. And so water is added to urea, thinking back to organic chemistry. And the bacterial urease enzymes produce ammonia and water. So urea and water combined, there's enzymes involved, and now you have ammonia and water. That's a good thing because ammonia raises the pH of your saliva in this case, right? And that helps feed good bacteria and keep them really, really healthy. And then the second way, and we're going to go to the next slide, is through arginine, which is what we've been talking about. So arginine can actually be found in your diet. Does anybody know any foods that have arginine in them? So sometimes if you play baseball, you would eat these. That's the clue.
I thought beans have a lot of arginine.
Beans do have arginine in them, but did someone? Okay, so there's a specific, it's not technically a nut. What I'm talking about is technically
Sunflower seeds.
Sunflower seeds. Sunflower seeds have a ton of arginine. And in fact, if I test someone's saliva and give them a handful of sunflower seeds and wait 10 minutes, they will have almost perfect saliva.
Wow.
And so what's amazing is this arginine basically goes through this ADS system, and it's arginine dihydrolase system, which is what you see here on the left-hand side of the screen. And what's really helpful is arginine goes to ornithine, and that breaks down to also have ammonia and carbon dioxide, which again, ammonia is the key factor here. So the bottom line is your body is constantly making ammonia to keep the pH neutral, which is one of the ways that it can help buffer. But also too, we can feed this side system with arginine if we wanted to boost the pH of your mouth. And so what's really helpful is that that's something that we can actually add to your diet in a safe way that can actually change your oral microbiome. And so you're probably wondering, why do we care so much that the pH of our mouth is neutral? Well, when we have this ammonia, that increases the pH of our plaque. It becomes more basic, so less like a lemon and more like baking soda. And when that happens, that allows our teeth to be more remineralized. So it just favors our teeth to stay a little bit harder. And to the way I like to think of it is, you know how our skin turns over, we have cell turnover all the time, and we wouldn't be able to heal if our skin didn't turn over and regenerate. The same is true for our teeth. It's the hardest surface in our body, and it's able to stay hard by taking on different minerals like calcium and phosphate, and sometimes fluoride like we find in toothpaste or water. And so when it's a high pH, our teeth are able to take in those minerals more easily. And also this high pH allows good bacteria to grow. I don't know if you've ever read anything on in a book or even in the news about a high alkaline diet. There's a reason for that. It actually helps feed the good bacteria throughout your entire body, which is why it came about. And the last piece is that the karyogenic or the tooth decay causing bacteria, they really struggle when the pH is high. And we don't want them to be successful. And so the higher we keep that pH, the less successful those tooth decay causing bacteria are. And so I like to look at this graphic. This was a really awesome article that was published in 2014, but the infographics in this article were just so helpful for understanding how your teeth can stay so healthy when it's more of a neutral pH, and why it's so challenging, and how the bacteria change when it's a really low pH or it's acidic like a lemon or a can of Coca-Cola. And so now that we understand this, I'm going to give 2 clinical examples of how I've seen ammonia be present in my patient's saliva. And so I'm going to give 2 examples because I just want to share a little bit of context. And I say, are you the good witch or the bad witch? Because I'm going to give you an example of ammonia levels when someone's really healthy, and then another when it's actually an indicator of systemic disease. And Dean Neeson, you're making me laugh.
She's falling out of her chair.
Okay. So this first case is one that's a little bit tricky. So remember how we talked about bacteria when they first started studying ammonia, how if your mouth is really, really clean, you'll have low levels of ammonia, right? But the other case is actually if you have a ton of good bacteria, you're not going to have disease, but those bacteria are going to be metabolizing arginine so much in your saliva and the urea process that you're actually going to have really high levels of ammonia. So this is the case of a healthy patient that has, when I say the squeakiest clean mouth. It was a 60-year-old male that I had, very low caries risk, so I wasn't worried about them developing a new tooth decay lesion. They took no medicine, no medications, but their levels of ammonia were high because their good bacteria were off the charts. And this is another patient. He had end-stage liver failure and was on the transplant list, and I was a part of his transplant team. So I had a really unique role of trying to maintain his oral cavity, and it was really interesting. He had a very high pH in his mouth, and he had very high levels of bacteria, mainly because we had to be very careful about inducing a bacteremia in this patient because he was such a high risk. So maintaining his oral health was a little bit challenging, and he actually had multiple episodes of encephalopathy. But what was really interesting is he had high levels of ammonia because that would start to build up when his liver was having major challenges and when he was actually going into one of his flare-ups of encephalopathy. And so what was interesting is when I took his saliva this day, he said, I'm starting to notice to have some neurological symptoms. He's like, I think I need to call my wife. And I remember saying, well, your saliva is showing me that, so I want to make sure I send this to your doctor so that they know I'm starting to see these higher levels. And so I was able to, communicate with his healthcare professional. We were actually able to get him into the hospital so that they could start to clear some of the ammonia from his system. But this is how we can use, just basic chairside screening to understand a little bit more about our patients. And so I'm going to pause because I want to ask, are there any questions about what we've talked about so far? Because what we're going to do is we're going to take the data from these articles and the data that we have from clinical cases. And now we're going to say, if you wanted to apply this to your daily life and change your own oral microbiome, what would we do? So that's the next phase. But are there any questions? Dr. Johnston?
Yes, Erinne, over the years, we've seen corollaries, and we were trained under the corollary that the higher the ammonia, worse the liver function was. And I'm not sure that stood the test of time. And I say that based upon asymptomatic patients have elevated ammonia levels and are functioning just fine. Now, can you correlate the same value with dental hygiene?
I understand your question. I'm going to relate it back to this patient first and kind of give you an example. So when we get these reports that say you have higher levels of ammonia or lower levels of ammonia, it's really looking at the ammonia levels within your saliva, and it's not measuring anything that's within your blood system, which is what they use to understand your liver function.
I think that's a distinction that needs to be driven home from the get-go.
Yes.
Yes.
So, and that's why I kind of gave examples of, you might see urea in your blood. You're going to see urea in your saliva, but remember, it's a completely different secretion, and it's just one that we can actually use to understand your oral cavity. The only reason in this case that I shared this information with the healthcare professional is because they were having, I was a part of their transplant team. So any data or any time this patient came to see me, I was able to report back on what I was finding, because they were trying to really move him up the transplant list. And so anything that kind of helped elevate his status was something that was helpful, but I wasn't looking to objectively measure his blood levels of ammonia.
Well, I
This was
understand.
just looking at his oral health.
And I understand that they're night and day, but it is there is that connection that it's natural to assume. It's natural to assume that you might have similar value in your mouth as you would in your blood.
Yes, so there's similar value in the sense we understand the impact certain measures might have, right? So looking at different measures, you can understand different levels of health, but the objective number and that measurement and what target values you're looking for in the oral cavity and your blood system are different.
Okay, thank you.
That's a really good question. I've actually never been asked that question, so that was really wonderful. Any other
Well,
questions?
I wouldn't have asked it had I not had that experience in years past.
Yeah.
But with time, there's always the other side of that equation, and that ammonia level is, irregardless of the ammonia level of patients doing fine, versus subtleties of encephalopathic behavior could correlate easily with the rising ammonia level. So it's just kind of a catch-22. You got to know your patient.
Absolutely. Absolutely. And I think what helped me here is he was starting to exhibit symptoms, and I had seen him enough trying to manage his case that I was able to pick up on that.
Yeah.
Okay, so after their research about toothpaste, researchers started to ask the question, where else can we put arginine? Arginine in its chemical form doesn't taste great. It's kind of bitter, sour. I don't know how to describe it. You know that it's in there. And so you have to make it taste really yummy. So it's easy to do that in toothpaste because toothpaste has a lot of flavoring like mints, right? But it can also be placed into candy. So this is really helpful for children, right? It's easy to have a child say, hey, here's a square Tootsie Roll, and this actually makes your mouth a lot healthier. And so Basic Bites taste exactly like a Tootsie Roll, but they're in a square like a Starburst, and they have arginine bicarbonate and calcium carbonate in them. And these two components not only provide calcium, which are minerals for the patient's teeth, but arginine so that those good bacteria that we've been growing, it can do the two things that it needs to do. Those bacteria are going to break down the arginine and produce ammonia, and that pH is going to then help make sure that those teeth can remineralize, but more importantly, it's going to help those good bacteria continue to grow. And so sometimes when you take something, I don't know about you, but I want to know what it's doing to the inside of my mouth, because when I look at a candy, I'm like, is this really going to make me healthier? Can a candy really make me healthier? And so this is just an example of someone who had average carcinogenic bacteria before they have a Basic Bite, really high level of acidity, really low or average level of buffer capacity. These middle markers, I can tell you, they have extremely healthy gum tissue, and this patient had really high levels of ammonia. So they probably had, this was first thing in the morning, and oftentimes that's when your biofilm's the healthiest because it's been growing overnight. So that makes sense to me seeing a bunch of patients. And so after taking a Basic Bite, the ammonia level started to go down, which makes sense because some of those bacteria, when you chew, are going to mechanically be removed, and it's going to take time for this ADS system to kick in. But what's really helpful is that the buffer capacity started to get a little bit higher, which was because two things. One, chewing stimulates your buffer capacity in your saliva. But the second piece is that there was arginine there to be metabolized and then for that ammonia to be produced. So the carcinogenic bacteria or the acidity started to go down, and then the buffer capacity started to go up. This syrup does have maltitol syrup in it, which is one of the sugars that is not as, doesn't feed your bacteria as much as like straight glucose. But because of they need to make arginine taste a little bit better. The carcinogenic bacteria markers, when they metabolize sugar, that's exactly what this marker measures. And so you can tell that you had a little bit of a Basic Bite. And so this is one of those examples where you can see that having this snack is more healthy than having maybe 2 or 3 Tootsie Rolls or a bunch of Starburst. And so it's a way to have a treat, but then have some of the really good elements such as arginine be included in that treat. And so that's something that can be really helpful for patients who are trying to change some of their habits and incorporate healthier habits into ones that they have every single day. And so when it comes to oral health prebiotics, we want to feed the good bacteria in our mouth. And arginine is an example of a prebiotic that, which is how we're feeding these good bacteria. And so today we went over some examples. So arginine toothpaste, there are also products out there that have urea. And so I just pull that out as an example. But before we talked about foods that have lots of arginine in them, and garlic, onions, leeks, chicory root, all of the grains. And then also there's a ton of fruits and vegetables like bananas, apples, and asparagus. One of the questions I was asked in a pediatric presentation probably a year and a half ago was by a neonatal nurse. And she said, I take care of a lot of babies. She's like, how could babies have arginine as they're, growing up? And I was like, I thought about it and I was like, well, bananas are a prebiotic. Bananas feed your good bacteria. And I said, babies love bananas and they're really easy to eat because they're soft and they can be mushed. So if you have children, know that when you feed them a banana, you're actually feeding the good bacteria in their mouth. And so why arginine? Today we talked a lot about why we want to feed our body with arginine, but whether you get that from your body naturally metabolizing urea or proteins, which is the first mechanism that we talked about, or you get it from the outside, which is you have sunflower seeds or you use the toothpaste with arginine. It's a way to increase ammonia in your mouth. And that ammonia increase is a way to increase the pH of your saliva. And that's one of the ways you can help prevent tooth decay, which is awesome. So I always give patients examples of, kind of how to incorporate this into their daily practice. But some of the ways is eating green leafy vegetables. Those have arginine. The candies that we talked about are basic bites. And there's actually a few different toothpaste. And I believe I have that, maybe it's on the next slide. There's a few different types of toothpaste that now have arginine in them and you can get them over the counter. And there's some with fluoride and without fluoride, but there's many different products that actually have arginine and I can promise you, you won't taste it. And the last piece is it's just really important to remember that arginine negatively impacts the growth of bacteria that have a pathogenic potential. In the case of dentistry and tooth decay, one of many bacteria that we're looking at is Streptococcus mutans. And so arginine impacts that bacteria specifically. And the more arginine that you have in your system, the more it's going to be metabolized. And that's how you can have more neutral saliva, which is really helpful. So if you wanted to implement this today at home, you can improve your oral hygiene because you want to make sure you have really good oral hygiene at home, drinking more water. And some of these are just like my normal hygiene tips, but the last time we had our wellness presentation, they were such a hit. I decided to keep a few in this presentation because I've had such positive feedback in Joplin. But when you want to boost your commensal bacteria, there's oral probiotics that you can take. But today our focus has been, you can actually incorporate arginine into your diet, into your toothpaste. And if you always need a sweet snack in the afternoon, if you can reach for a basic bite, that's a really good option because as we saw, it can change the pH of your mouth. And so the two toothpastes that I show you below both have arginine in them. And the one on the right has fluoride as well. So that's the one you want to go for, but I show both of them because these are the two examples that you can find at Walmart, at Target, or on Amazon. And it's something that you can bring into your day-to-day life. And I think arginine, understanding the role of arginine and ammonia in your oral health is a really amazing way of seeing how research not only helped us understand the oral microbiome and the system within your mouth, but it was actually something that led to interventions that allowed us to help create a healthier microbiome. And it influences not only what we do at home, what we can eat, but also, you know, our practice, what we use to brush our teeth or what we have for a snack in the afternoon. And it's just an excellent example of how 1940s bench research progressed to influencing what I use on my toothbrush every day. And I think that's just, it's inspiring to me, you know, almost 80 years later, the research someone was doing has totally influenced and helps us understand how healthy you are based on what's in your saliva. And are there any questions? I'm going to stop sharing my screen so I can see you, because right now I can only see one thing. Let's see, I have two screens here.
Thank you, Dr. Kennedy. That was awesome. I'm sure people have some questions. In the meantime, while I know Anne Marie's going to field this, or Dr. Stottinger, I just want to remind people I had attached a very recent publication from Journal of Dental Research, the Human Salivary Proteome Wiki, which is a resource for those who are interested in salivary research. So I just draw your attention to that. And if you had difficulty locating it, I'm sure Anne Marie can send it to the group.
Yeah, definitely. It's on Canvas if you want to find it there. It's also in the mass email that went out. And if you're still having trouble, please feel free to email me and I can send it on to whoever needs it.
Thank you all. Does anyone have any questions? Oh, we have to do our pause at the end. I'm so sorry. Oh, okay. Go ahead, Dr. Wolf.
I wasn't going to ask anything. I was going to wait for somebody else to ask something first. But so I was curious, a couple things actually. I always thought of saliva as being a flow through thing in my mouth. So I thought I was making it, and the idea that I would eat sunflower seeds and all of a sudden have more arginine in my mouth necessitated the presence of a reservoir for accumulating it, or else I was getting it from the blood. So I was curious how and why even your healthy bites is going to, I try not to let candy sticking on my teeth, for example. So how and why that was actually going to be beneficial over time. And then the other question that I had was, there's also the notion of using baking soda to brush your teeth and things like that, and the interactions that you would expect to see between baking soda and ammonia here. So from a kidney perspective, we think of ammonia as being this really valuable non-titratable buffer that our body can use to regenerate the needed ammonia, or the needed bicarbonate that comes from consuming a net acidic diet. So that's me blabbing off in your general direction.
Yeah, so I'm going to answer your second question first. And if I forget the first one, it's just remind me. But your second question about baking soda and ammonia, I actually have patients who have basic bites and sodium bicarbonate. So you are totally spot on when you talk about ammonia being an excellent buffer, which is why we want to have more of that in the saliva. When you have a net acidic diet, the reality is that there are a lot of acidic attacks on your oral cavity throughout the day, especially if you sip something that has acid in it, like a sparkling water, or if you sip something that has sugar in it, like a soda or a coffee, or if you just snack throughout the day. And so it is important to help your oral cavity neutralize itself unless you're eating a fully alkaline diet, right? Which I don't think any of us in the room probably are, especially with the way just society is and how challenging that would be. And so because of that, we have to come up with innovative ways to help patients be healthier. And so that's where arginine came about. It's not, the reality is that if you had a fully alkaline diet and you were eating healthy and didn't really have any sugar, your body would have not only endogenous, it would be through that endogenous pathway of breaking down protein and your metabolic arginine and urea, it would be healthy. Your body doesn't actually need extra arginine to be healthy. It's just we're not healthy because of various factors, whether it's systemic disease or having a high carbohydrate diet or etc. And so in order to prevent disease in our oral cavity, we're finding what I call like just other mechanisms for making yourself healthier. So if you take a look at Native Alaskans, we've studied, there's been so much research on Native Alaskan populations. They, on the tundra, there's 7 different types of berries that grow, kale, and then wild seafood and very lean meats. And so with those 4 components to their diet, they actually had one of the lowest incident rates of chronic disease that's ever been documented, and basically no oral disease, or a very minimal amount of oral disease, whether it's tooth decay or periodontal disease. And so that's a really good example of an alkaline diet that helped them naturally be healthy in that way. So to your point, that leads me to your first question. Your first question is a candy really going to make me healthier? It's a step in the right direction. So if you were eating Starburst, or you were going to reach for a cookie, or you were going to, I don't know, have a piece of chocolate or something like that, the basic bites are a way to make that activity healthier and at least provide the bacteria in your mouth some of the components that they need to help neutralize the pH when they're exposed to sugar. So it's a step towards health, because the reality is that it's very difficult to, have a diet that's very highly alkaline today. Go ahead, Dr. Kurla.
Thank you. Great presentation. I love this stuff. It's fascinating. But I wanted to ask about ascorbic acid, like if you take vitamin C, cough and cold, flu season, that sort of thing, does that negatively adversely affect the biome?
I always like to explain this to my patients: checks and balances. You need vitamin C, and maybe it's cold and flu season, so you're going to prioritize that. The key to that is taking it, not sipping on it throughout the day. So I always think, those little vitamin C packets that sometimes people take. I've seen patients put that into a big old water bottle and then sip on that acidic drink for a really long period of time. That's not my recommendation. My recommendation is, okay, take the vitamin C, but do it in an instance, because and the same is true for coffee. So if you're someone that's prone to tooth decay, or you go to your dentist and you regularly have new lesions, if you're sipping on something throughout the day, your body's buffer system doesn't have a chance to ever buffer that, and it's always working. And so if you can isolate it to instances, and a lot of times dentists will tell you around meals, but if you can isolate it to instances, then it's a lot easy. Your body is naturally made to have you eat a meal and then buffer after the meal. And the analogy that I use that has always helped patients understand this is, think of a sprinter. A sprinter is designed to sprint for 100 meters. Now, if I ask that sprinter to go run 26.2 miles, like what I like to run, they would have a really hard time, because they were not designed to run 26.2 miles. That's what your body's buffering system, your oral buffering system, goes through when, instead of having a 100-meter race for it to buffer after, you ask it to buffer all day long. And the quality of your buffering system goes down. So you can have your vitamin C, but just do it in a small, like at one point in time.
Makes sense. Thank you.
You're welcome. Hopefully I haven't put you all to sleep yet. We have about 3 minutes left, and I would love to hear, we talked about what you knew about saliva, what you wanted to know about saliva, and what you learned. Did anyone learn something that they wanted to know about saliva?
I learned things, but I didn't know that I needed to know them.
Welcome to my world, Sharon. I love it.
I would agree with that 100%. Like, I thought I knew stuff, but I don't know. I just learned so much more. Like, after work today, I'm going to go buy a different toothpaste with arginine in it, I think.
Anne Marie, if you just wait till January 3rd, which you can go get toothpaste if you want, I can bring you a tube.
I appreciate that. I'll let you know. I'll let you know if I make it to Target or not.
Okay.
Well, I thought, here's another question then. On that toothpaste thing, I thought I was helping the situation by getting Arm & Hammer toothpaste,
Oh, Arm & Hammer's great.
but it tastes terrible. And I mean, I used to brush my teeth with baking soda and then use a fluoride rinse,
hmm
you know, but the particular version of Arm & Hammer that I got, I'm going to have to get something else. So,
Well, here's a little tip about toothpaste. You want your teeth to have contact with the good things inside toothpaste for as long as possible. So fluoride, Dee Neeson's the queen of fluoride. And you want to keep fluoride in contact with your teeth for as long as possible. That's why when you go and have the professional varnishes placed, it's helpful because the way that they create those varnishes, it sticks to your tooth and it basically creates a shield that has a bunch of fluoride, which is that green rock right there, held onto your tooth structure for as long as, so Dr. Champion's giving away my tip, but I always tell patients, like, you can leave the foam alone. So
Right.
when you brush your teeth and you spit and you go like this and you do your angry monster face, like I explain to my pediatric patients all the time, and you see those little bubbles in between your teeth, keep the bubbles there. Those bubbles are like a little teeny tiny army that are making your teeth so strong.
Mhm.
As you can see, I do a lot of pediatric education and I'm so sorry.
no, it works for me. I relate to it. But also
It's actually a good tip to floss right at that point in time because you are going to move that toothpaste in between your teeth. It's
Oh,
good
that's
to
cool.
floss then.
I flossed before.
Try flossing during then because you're pushing that up there.
Okay.
Dr. Wolf.
I did have one more question, and that was how good of a biomarker for blood do you think saliva is? I mean, what is your exchange, the extent of exchange, the rate of exchange between blood and saliva?
Yeah, so it's they are working on understanding that in a better capacity. But I will say one of the relationships that they've started to look at, which is a little bit different than what the question you're asking, but it's very helpful, is they've actually, they've created a sub-occult blood test for your saliva, which is very similar to it's the exact same test that they use for your stool. And now they're able to understand in saliva, even the tiniest amount of blood that you might not be able to see is an indicator for gingivitis and a strong indicator for periodontal disease. So why is that helpful? That's helpful because if you have patients who don't have access to care, you can actually have their saliva go onto a little card, understand how at risk they are for gingivitis or periodontal disease, and then screen out really healthy patients and make sure patients who have severe disease can get care without even doing a very extensive full exam of their dentition. But Dr. Wolf, they're still trying to understand are blood and saliva equivalent for some markers and how different are they for others? And certain components like glucose is where they're starting, and they're still looking into that. So it's different for each and every one of these. What I will say is that the current chairside screening tools that we have do not provide the objective numbers that you get from like a blood test. They're really helping, they're serving more as a comparison tool. And so I've spoken with, I don't know how many researchers on making it be more objective, just like the numbers that we would look at on a blood test. But they have not been able to do that chairside yet. So I don't know if Dr. Gordon, you can add to that, but my understanding is that we're still really exploring that. I want to tell you that we should be farther along, I think, with saliva. We kind of own it as dentists, but it's actually a very new field.
Yeah, I just wanted to add, because on your chart, Erinne, I noticed one of the areas for the healthy is, how much gingival crevicular fluid is contributing to the saliva. So I just wanted to say that it is a very active area of investigation, but you also have a contribution of gingival crevicular fluid into your oral cavity, which mixes with the saliva. And the GCF is much closer to plasma in blood. But the issue is there's a lot more filtration that's happening than direct access to, a venous access.
Mhm.
So, and then there's also contaminants in the oral cavity, which, can happen as well because it's an open system. So there are some areas that are super equivalent and there's some areas that are not, but there's a lot of areas of active investigation.
Dr. Krilla.
I just wanted to share, this toothpaste thing really has me. I'm sorry. I'll try not to be too much of a pain. But I had, as I said, I got the Arm & Hammer. Interestingly enough, because I remembered, I knew about the fluoride and, don't keep the foam or whatever the saying
Yeah,
is.
leave the foam alone.
Yeah, and I was doing that, and I had done the other toothpaste with the baking soda, so I was following the directions here. Well, what's interesting is about the Arm & Hammer with the fluoride in it,
Mhm.
it tells you to rinse thoroughly after the brushing. And
know.
so I'd never seen that on a toothpaste direction before.
Yeah, I've read that. Trust me, I've talked to Arm & Hammer, and it's tricky. I can't understand what they're doing because the way it works, it's just
Yeah.
like anything else. If you had a medication and you wanted
Yeah,
to put a
leave it in
medication on
place,
your
yeah.
face, right? You wouldn't put it on and wash it off.
Yeah.
Right?
Yeah,
You
I
would
agree.
put it on and you'd want the cream to stay on there so that, if you had your rash or whatever, it would be treated.
Mhm.
So I'm not sure
I
why
just
they
wanted to
have.
make sure you knew that. I figured you were
You need
aware of
that
it, but I thought that was odd, so.
Well,
Go ahead, Linda.
no, I was just going to say, I'm wondering if it's related. Baking soda is very salty. And for people with hypertension, it's contraindicated. So the rinsing may be related to getting the salt out of the mouth. And
I follow
not-
your thoughts, but it still seems
Yeah.
like it would be a minimal amount absorbed to affect your blood pressure. That'd be an interesting question to ask, I guess.
Maybe we should just call
Yeah,
Arm &
yeah.
Hammer.
There you
Yeah.
go.
Yeah.
I just will say, I don't really know the answer, but I can speculate, having done a lot of clinical trials for
Yeah.
FDA approval. Sometimes it's because what goes on the label is what you did in the protocol, and that dictates your labeling. And so it might not necessarily be necessary, but it might be something that was forced on the label because of the way the study was conducted.
That's a good point. So
And-
what does it say completely behind you? We can't read it all.
Oh,
I don't
all I
know.
want for Christmas is my 2 front teeth.
Of course it does.
And Dr. Krilla, I should just say, anytime you leave the foam alone, you always spit out the toothpaste first. You don't swallow it.
Oh, yeah. Oh, yeah.
I don't know if I mentioned that earlier, but now I'm like, now that we're talking about very specific directions, I thought, well, maybe I
I'd
should.
already
do
gotten that one down, so I'm good. But
All
thanks for checking. I appreciate
Good, we're
it.
on the same page. Okay, well, I've kept everyone after 5 Eastern time, 4 Central time. So I just want to, if there are no questions, I just want to say thank you to Anne-Marie and Dr. Staudinger. And I hope you all have a wonderful holiday break and a really happy new year.
Yes,
Thank
thank
you.
you so much.
Thank
That was a
you.
great presentation.
Thank you.
Thank you, everyone.
All right.
I
Thank
had
you.
a quick parting thought. I worked in a nursing home when I was in college, and I took care of a retired dentist. And his apparent quote was, "Always be true to your teeth, and they'll never be false to you."
Oh,
Good one.
thank you, Dr. Wolf.
Happy holidays, everyone.
Thank you all.
Bye, everyone.
Bye.
All right. Bye-bye.